guys, welcome back to my YouTube channel. Hope you guys enjoyed my last video. Well, I hope it was useful to you all. So today I'm going to be talking about an health issue which is actually very common among men of nowadays. About 10% of men are said to suffer from this disease. It's known as the erectile dysfunction, which we all know as impotency. Yeah, I'm very sure this is not the first time you're hearing about this. Actually, let me start by stating some facts about this erectile dysfunction. About 2.3 millions of men in the UK are said to suffer from erectile dysfunction. 33% of men hardly seek advice about erectile dysfunction. About 40 to 50% infertility in male is caused by erectile dysfunction. 20% to 30% breakdowns in relationship is also caused by this same erectile dysfunction. Wow. So you see it's worth addressing and talking about. First of all, what is erectile dysfunction? For me, erectile dysfunction is just the inability to achieve an ejaculation, or it's also the persistent or consistent inability to maintain an erection during sexual activities, any sexual activities. So I'm going to be stating, normally anyways, erectile dysfunction is not normally regarded as a problem, but it's important for us to know the symptoms of this erectile dysfunction. So I'm going to be listing few symptoms of erectile dysfunction, which could include trouble getting an erection, trouble maintaining an erection, and reduced sexual desires. Wow. Like having a very reduced sexual desires could be a very big problem for men. Anyways, as far as I'm concerned, there's always a cause for something to come up. So I'm going to be listing the causes of erectile dysfunction. We have the physiological and the physical causes. The physical causes could include high cholesterol, high insulin level in the body, Peyronie's disease. When I say Peyronie's disease, it's just like development of scars tissue in the penis. Parkinson's disease, injuries or surgeries in the spinal cord could also lead to erectile dysfunction. And let me list the physical causes of erectile dysfunction. Most time we should all know that our brain also plays a key role in stuff like this, because it triggers a series of physical activities that will make you have a good erection, starting from sexual excitement. So there are some things that could interfere with this erectile dysfunction, such as depression, anxiety, stress. A lot of things can actually be associated or cause an erectile dysfunction. So so for now there's a way whereby it is diagnosed. Most times it's actually diagnosed by the doctor, whereby you are asked some questions about your medical histories in particular, or a physical examination is done. But most time when the doctor finds out an underlying conditions which is associated with erectile dysfunction, you are referred to a specialist or something. So when I say underlying conditions, there are some tests whereby you can there are tests for this underlying conditions, such as physical examination, whereby your penis and testicle is carefully examined and your nerves are checked if it is very sensitive, or urinalysis, whereby your urine is taken to the lab to test for chronic health conditions, blood tests, and the likes. So I'm going to be talking about the complications associated with erectile dysfunction. When I say complications associated, what you might face due to the fact that you have this disease, it could be stress or anxiety, inability to get your wife pregnant, embarrassment and low self-esteem. It's a disease that most of men don't really like this, so it could cause a lot. You might be depressed due to these things and the like. So as you all know, there's always a treatment for something. Yeah, actually until recently the only treatment for erectile dysfunction was aprostadil, which was always injected to the penis or inserted into the urethra. But lately, recent study found out that other oral treatment came up, such as this sildenafil, which came up around sildenafil. Like then after sildenafil, then some oral treatment came out, such as verdenafil, tadalafil, apomorphine, and the likes. So these ones are oral treatment. They are the PDE5, which are called phosphodiesterase type 5 inhibitors. Actually, we have a lot of phosphodiesterase in the body, but the one related to penile function is the PDE5, which is also known as the phosphodiesterase type 5 inhibitors. Like they all say, prevention is better than cure. Yeah, so for us to prevent this disease, it's important for us to keep up with our doctors and try and live a healthy lifestyle, like getting enough rest for yourself, exercising regularly, going for regular checkups. A lot of things that you should do to stop these things and avoid alcohol or stop alcohol and illegal drugs. Anyways, apart from that, we have some natural remedies to stop this, such as the use of ginseng, Korea root ginseng, or the use of garlic. Those are the ones I can remember for now. So I would also like you guys to read more about it. So I'm going to be putting a reference, someone that you can also refer to know more about this disease. So I hope you guys enjoyed my video, and I hope you guys were able to learn something from this video. And because you're here watching this video, that doesn't make you ignore or just overlook it. You have brothers, you have friends, you have it's also good to educate ourselves. It's not until you have this kind of disease you should know, or until our family, we have neighbors. It's no big deal helping your neighbors, and you know what I'm trying to say. So I hope you guys enjoyed my video, and thanks for listening. See you in my next video. I love you all, and don't forget to like and hit the subscribe button. Bye. I love you all.